Hello, everyone. I'm Dr. Angela Mattke, and welcome to Ask the Mayo Mom. I'm a pediatrician at Mayo Clinic Children's Center in Rochester, Minnesota, and host of this show about pediatric health topics. February 7th through the 14th is Congenital Heart Disease Awareness Week. So today we are honoring those living with congenital heart disease by talking about heart transplantation in children and teens. Joining us for this discussion is Dr. Rebecca Ameduri, a pediatric cardiologist who specializes in caring for children who need and receive heart transplantation. Dr. Ameduri is the medical director of the Pediatric Heart Transplant Program at Mayo Clinic Children's Center and works closely with our cardiac surgeons and others on the multidisciplinary team that care for these children. If you're listening live, remember we want to hear from you. We want to hear your questions. So please try to send them in during the live broadcast and we'll do our best to try to answer them. Dr. Ameduri, thank you so much for joining us today.
Thank you for having me. I'm excited to be here.
I'm excited to have you as well. So I think it's really important to understand that not all children who have congenital heart disease will end up needing heart transplantation. Is that a pretty accurate statement?
Correct. When we look at kind of the population that comes to transplant, it's variable depending on the age of the child, the different diagnoses that we see. And so some of them are children born with congenital heart defects, either immediately in the newborn period or after they've had multiple surgeries and then still potentially need to go on to heart transplantation. Others are children that were born with cardiomyopathies of different types where they have abnormal heart muscle or abnormal heart rhythms, and we sometimes need to have those children also go on to transplant.
Okay. So how is it determined that a child might need to go on to transplant versus some other type of palliative surgery that can be done to kind of push the need back for heart transplantation?
Yeah, so ideally we want kids to be able to live with their own heart for as long as possible, because transplant is not a cure-all that, we're trading one set of problems with congenital heart disease or heart failure for another set of problems with heart transplantation. But we try to get kids with their own native heart as long as possible. However, if we think that their survival with transplantation and their quality of life with transplant is going to be significantly better, then we will kind of shift gears and head down that pathway. There are particular cases with babies where there are certain high-risk surgeries where we think transplant might be a better first stage. Otherwise, we try to do palliative surgeries until we kind of reach an endpoint where we feel it's too high risk to continue to proceed down that pathway and that we need to move on to transplant.
Okay. I imagine it's a really extensive process and it's not just a decision made, um, in willy-nilly or impulsively. I'm sure it involves extensive communication with lots of invested providers and the family and other things. Can you kind of take us through what that discussions and that process looks like?
Yeah, so it is quite a complex process with kind of a very multidisciplinary team involved in the care of those patients. Oftentimes if we're talking about it more urgently, it's somebody that's in the hospital, and so we're involving the cardiac ICU team, the surgical team, the cardiology team. We have other subspecialists that we engage because we want to look at the child as a whole, not just about their heart defect or their heart problem, but also look at the child as a whole to say what other organs are affected by their heart failure, what else might we need to think about, and how do we best manage them both before and after transplant to give them the best quality of life. So we involve other specialists like transplant infectious disease, pulmonology, nephrology, oftentimes the GI doctors or liver specialists. Pharmacy is engaged with those patients also, social work, our transplant coordinators and transplant surgeons. So it is quite a multidisciplinary team. When we kind of go through all those consultations and that comprehensive evaluation, we then sit down as a team with all of those players at the table and say, number one, do we think this child needs transplant at this point, or are there other things that we can recommend? Number two, do we think they're a good candidate for transplant? Are there things about them that would be too high risk, or are there other things that we can recommend for them at this point? And then do we all agree that we should move forward listing them for transplantation?
Okay. Once the child is listed for heart transplantation, how is a match determined between that patient and the potential donor?
Yeah, so in the US, organ donation is controlled on a national basis through UNOS, or the United Network for Organ Sharing. And so when we actually list a patient, we put them on a list with UNOS. We list them based on their blood group, their age and their size, and determine kind of an acceptable age and size range of donors that we'd be willing to accept. We then determine also a priority status, and there's very specific criteria for how sick that child is and what priority status they qualify for. And then it's a computerized match system to try and match up those donor organs with recipients who are the sickest, who have been waiting the longest first. And so it's a computerized match system that happens. That being said, don't necessarily have to be kind of top of the list in order to get a donor organ. There may be reasons that someone ahead of us might turn it down for size or for antibodies or for other reasons that they may not accept a donor organ. But in general, the longer that patients are on the wait list, the more likely they are to get a transplant. And also the sicker they are, the higher priority status they are, the more likely they are to get a transplant in kind of a shorter time period.
Just talking about that donor heart, it seems like a really good time to make a plug for awareness about people being donors. Can you talk a little bit about that process and how people make their wishes known to their loved ones?
Yeah, that's a great question. So the majority of our heart donors, particularly in pediatrics, are what we call brain dead donors. So they are children or young adults who have had some trauma or some accident where they are no longer alive. Their time of death is actually the time when they have that brain death exam. And they are kept alive with breathing tube and medicines to kind of keep their organs functioning while those organs can be placed with potential recipients, and while we do that whole allocation process to find recipients for their organs. And obviously in young adults, they can choose for themselves on their driver's license to note that they want to be an organ donor. But it is very important for people to make their wishes known to their family and loved ones so that they know that if they are approached about that, that they can proceed with that person's wishes. It's incredibly important in pediatrics as well. I think it's very challenging because you have these families that are going through a very traumatic event. And to even think about that for their child. But the important thing is that those organs can live on in somebody else and give somebody else a second chance at life. At my former job, we actually had made T-shirts for kids that we gave them after their transplant, and it said, "Inside this child beats the heart of a hero." And that's really how I want families to think about organ donation, is that your child, if you should ever have that traumatic event, that your child can be a hero for somebody else and allow them to live on.
You're making me tear up here. Just that is a really beautiful statement and very, very true. So I guess that's just important for people to kind of keep that message around. It doesn't have to be heart transplantation. It may be there's so many different ways that people can be donors and continue to let somebody else live on. Yeah, it's a beautiful, beautiful thing. Okay, shifting gears before I start crying and tearing up more. What is life like for that child after that heart transplantation? I mean, I'm sure their life is defined pretty much from before and after that point going forward.
Yeah, so I tell families and children as we're going through the transplant evaluation process that the first couple of months after transplant, that their medicines, their follow-up appointments is going to be like a full-time job, because that first couple of months is really critical for us to monitor them for signs of rejection, because we're giving them immune suppression, also monitoring for signs of infection, and just really keeping a close eye on them as that new heart settles in with their body and their immune system. Once we get further out, then kind of at 3 to 6 months, we try to get kids back to normal life and normal activities. And oftentimes they're able to do so much more than what they could before transplant. Many of these kids, particularly those that were born with congenital heart defects that have been through many surgeries, don't realize how limited they are because it was just their normal. And then once they get that transplant and they have that energy that they just have never had. I usually ask kids kind of at about the 3-month mark, I'll say, do you feel better than before transplant yet? And they'll say, oh yeah, like the energy level and the amount that I'm able to do, the amount that I'm able to walk and what I'm able to do is just amazing. And for me, that's why I'm doing what I do, right? The goal is that we give them a better quality of life. That really is our focus, is that there's no guarantees with transplant. There's no guarantees with the heart surgeries that these kids go through. But our goal is for as long as they can have to give them the best quality of life. And so we're talking about kids that have severe heart failure and that don't really have many other options, that we can give them a better quality of life. Probably my best patient at about 6 weeks, which we tell them that, you know, the heart transplant requires a sternotomy, that it's like any other broken bone. They need to give it about 6 weeks to heal before they can kind of get back to normal activities. And literally on the 6-week mark, her mom sent me a video of her playing volleyball, and she was like doing a dive on the volleyball court. And I was like, I don't know that that's normal activities after a sternotomy, but as long as she's feeling up to it, that's great. So
Wow.
that really is our goal, is to get kids to a normal quality of life.
That's it's a very beautiful picture that you just painted about her diving and, you know, landing on her chest and just going for it. So
Yes.
you know, you said there's no guarantee with heart transplant. So can we talk a little bit more about what we know about the outcomes and prognosis for children after heart transplant?
Yeah, so the overall survival for children, so if we talk about kind of all comers 18 and less at the time of transplant, the overall survival now is about 95% at 1 year. So we're doing quite well with that early survival. The later survival is really age dependent. And so infants and young children who go on to heart transplant are doing very well long term. We know that if their immune system is still developing when we put that heart in, they tend to have a immune tolerance and are able to kind of have their immune system develop with that heart in there. They tend to have much lower rates of rejection, need much less immune suppression, and do very well long term. So if we look at kind of long-term follow-up data, over 60% of infants are still alive on their initial transplant at about 30 years. So they can do very well. Now, if we look at adolescents, they're similar to the adult numbers, where about 50% of patients are alive on their initial transplant at 14 to 15 years. So that's where we say this isn't a cure, this isn't, you know, a perfect solution, but this is taking somebody who has severe heart failure and limited options and getting them much more time. Now, when we look at the field of transplant as a whole, pediatric transplant is still relatively young. It's about 35 to 40 years that we've really been doing it in large numbers. And so if I tell patients, well, if we get you 15 years, I have no idea what this is going to look like 15 years from now, what we're going to be able to do. And so even though that number doesn't sound perfect, it's going to give us options down the line.
Mm-hmm. There's so much innovation that continues to happen in your field. Can you share a little bit about what's new and upcoming in the field of heart transplant?
Yeah, so I think probably some of the biggest areas of research right now is related to immune suppression and better understanding of the immune system so that we decrease the risk of rejecting that heart. Our goal being more targeted immune suppression, and so we're not affecting other organ systems as much and causing other problems for those recipients. And then the other piece of it is donation. How do we decrease the risk of dying on the wait list, or how do we better match up patients with organ donors that are out there? So there are kind of new systems, something called like Heart in the Box that you might have heard about, or we've heard Lung in the Box or Heart in the Box for donation. And this is allowing us to utilize organs that are further away, so that we can kind of expand our donor pool a bit, go a further distance than we typically would, because we're able to perfuse that heart and keep it pumping while we transport it to get it here for our recipient. So we actually did the first one of those in a pediatric patient here at Mayo last week. It's really exciting that we're able to bring that new technology here and able to go quite a further distance to get that donor heart that we otherwise wouldn't have been able to.
Yeah, that is very exciting, and exciting for what the future might bring, for more people being able to receive hearts sooner. So,
Absolutely.
Is there anything that families tell you that they wish they would have known before the transplant process, or that like they actively go forth and share with other families that are waiting on the transplant list?
I try to connect families who, as they're going through that evaluation process, I try to connect families with somebody who's on the other end of it, because I think that there's nobody that can speak better to the process than somebody who's already lived it. And so I really do try to find families that either are early in that process or that are even further out, because I think that it's so helpful for families to be able to have another resource. I'm very open and upfront with families about the realities of this may not be an easy road, and there may be a lot of bumps in the road, and but at the same time, we're only taking this path because we don't really have any other options. And oftentimes when I meet families, they've been told that there's no option. And so when they meet us and we start the conversation about transplant, they often feel like we finally have some hope. We finally have hope that there is a path forward and that our child does have a chance to survive this. So I think that that's kind of my initial role, is to give these families hope, but also with a dose of reality to say, this may not work and this isn't perfect. And so we're going to do what we can to get you through, but be prepared for the potentials.
Is there any online support groups or national, international groups that you would recommend families connect with early on in this process for support and resources?
Yeah, so we're involved from a research perspective in a national registry through the Pediatric Heart Transplant Society, and they have developed a lot of family resources. So there's a lot of educational materials and resources there. There's also, if it's a cardiomyopathy diagnosis, there's the Children's Cardiomyopathy Foundation that also has really great resources on cardiomyopathies. But I really think kind of individualizing it and saying, we're going to connect you with another family that's walked this path here at Mayo Clinic, that really can be beneficial for families as well.
Last question. So how can friends and family help support that nuclear family of primary care providers to that child during this process? Because it's long, and sometimes people only think about that immediate transplant period. What would you offer to them?
Yeah, I think, trying to put that child first, and making sure things like vaccinations and hand hygiene, and, as much as you want to see that child and family, making sure that you're only doing it if you're healthy, so that you're decreasing the risk of infection for that immune suppressed child. And oftentimes it's taking away some of the burden of the other children and the other family things that need to happen, so that the parents really can focus on that immune suppressed child and really focus life on them. I would say that's probably the biggest thing that parents ask for, is feeling like they can focus on their child when they need to be here, and kind of alleviating some of that home burden.
So we've reached the end of our time. Do you have any final thoughts for our listeners?
I would just say that there's great resources here at Mayo, and I think that there's great resources within the pediatric heart and transplant communities. So we're always open for questions. If there's things that come up, you can always reach out, and we'll try to connect you with appropriate resources to answer those questions.
Excellent. Thank you so much for joining us today, Dr. Ameduri, and giving your insights into a really, really hard topic, but there's so much hope with it as well.
Absolutely. Thank you so much for having me.
Thanks everyone who listened. And like Dr. Ameduri said, remember to get your immunization so you can help protect our most vulnerable children, those that are immunosuppressed and who aren't able to get their immunizations.
We're off air.
Awesome. Thank you.